decided to say no to circumcision, and I survived. I'm still a woman without the cut. And for the ones who are circumcised, it does not make you less a woman.
FGM, and sometimes it's called FGC, stands for Female Genital Mutilation or Female Genital Cutting, and it's the act of removing a part of a woman's genitalia.
The Maasai are an ethnic group of more than 1 million people living in southern Kenya and northern Tanzania.
The Maasai perform FGM as a rite of passage. So it's usually young girls who are going into puberty that would have FGC done, and it's an actual ceremony.
You are not given it.
A razor blade is often used for the cut. It may be used over and over, so it gets dull. The blade can transmit life-threatening infections. There have been cases where girls have bled to death after FGM.
It can have an impact on if a young girl will actually go to school. So often if you've had this procedure done, the chances of you going and completing school based on where you've stopped while you then have the procedure are very low. Number 2, early marriage, because now you've actually hit puberty, so the idea is that you'll get married soon after. The expectation now is that you're going to have babies. So all of these things create complications around childbirth for women who have undergone this procedure. If you don't have an advocate within the community, or if a community hasn't decided they're going to end FGM, it's hard to say that a girl can avoid it. So usually the only choice you have is to run away, or you may have a parent that may advocate for you and you don't have the procedure done. But it takes a lot more than just you personally avoiding it.
FGM is most common in Africa and the Middle East, but it's practiced in other parts of the world as well. The World Health Organization estimates that 200 million girls and women alive today have undergone female genital mutilation. Most were under 15 when it was done. In Kenya, more than 1/4 of the female population has been circumcised, according to UNICEF.
My name is Beverly Lanui. I'm 18 years old. I cleared my high school last year, but currently I'm studying computer course, and I'm also working with the community in hospitals and in school as my part-time. Personally, I fear cuts in my body, so I saw it like it's a torture, having a wound inside your body and also lacking some parts of your body in the name of being a culture. My father is a Maasai, a pure Maasai man. He said that you're a big girl and you cannot stay here without being circumcised. So when I heard that, I ran away from home and went to my grandparents to seek help and refuge from them.
Beverly's father didn't see why a girl should get an education. He insisted she be circumcised and married instead. She was only 14 years old.
Personally, I was very fearful. I was like, what is next with my life? If I say no, can he send people to come and kill me? Can he send people to come and take me by force and take me to undergo it?
The Amref is a health development organization, and we've been headquartered in Kenya for over 60 years. Our work really centers around health, and health for women, children, youth. We work at the community level. We work with community health workers. We do a lot of training, so training of midwives and nurses to ensure that the health system is responsive to the needs of a community. ARP is Amref's program, which stands for the Alternative Rites of Passage. And we've done this program in Kenya and specifically with Maasai communities. So what we believe in is that the actual ceremony should remain. It is part of the culture. What we advocate for is to remove the cut.
The experience was good because I learned the disadvantages of undergoing the circumcision, and also I learned the advantages of saying no to the cut. And it also encouraged me to know that I did the right decision to say no to the FGMs.
Kesidai kanyor. Ore entoki naisumi ntoyie naa ore nye emuratare naa enkinyala. Enemitikini enkisuma naa enkinyala. Tenishori akutitik naa enkinyala. Naa tenerakini sii naaji oltung'ani entoki nabo enemeyieu naa enkinyala.
We work with the elders, we work with women, we work with men. We work with what they call morans. They're the ones who actually marry the young girls. And we need them to be on board that a woman who's not had FGM is also somebody you can marry.
I organized the forum or the meeting of young mothers. Through that forum of young mothers, I come and call Amref. And I tell Amref, I want to request you guys to come and facilitate the training of young mothers to know effect of FGM, to know importance of education, to know importance of health.
It's really important to work with the young girls themselves. They need to know that they have a right not to undergo this procedure. And young girls or youth in general can actually create change within a community.
Husband's time is not right now, and when you have a chance to study, take good care of that chance. Many want to be in school but are not getting that chance. But for you who has that chance, can you utilize it? Continue standing out and saying, yes, I did the right decision to refuse to be circumcised. And for the ones who are circumcised, it does not make you less a woman. They never give up in life. As much as education may be hard, it's never easy anyway. They say the roots are bitter, but the fruits are sweet. I'm now enjoying the sweetness of the fruits.
Amref's vision and what we're working on and launched in 2016 is to end FGM/FGC by 2030. If you know better, you do better. And with more knowledge around how dangerous female genital mutilation is, the change, I think it's more long-lasting and sustainable.
Read the books like no one else's business. Don't listen to people. Say no when you have to say no, and say yes when you have to say yes. And listen to your heart, not to your ears. And I bet you'll be successful.
My name is Susan Joki.
My name is Damaris.
My name is Dorcas Naileb.
I'm in class 8, the last class in primary school.
When I grow up, I want to become a lawyer.
I love science because I want to be a doctor.
I want to become a teacher.
When I become rich, I help poor persons.
I want to become rich and help the needy. Girls need to educate because when a girl is educated, she will be the mother of the world tomorrow.